Modern-day EHRs tend to be centered around events, or encounters. Every time you contact a healthcare provider, be it in person, on the phone, or even online, a new encounter is created. Let's dive a little deeper into what encounters actually are and how we can classify them. The most obvious way to classify encounters is by the type of contact. Are you physically interacting with a patient, talking with them on the phone, or connecting with them over the internet? Or perhaps just connecting with other members of the care team? Let's go through these systematically. First, think through all the types of in-person encounters you might have with the healthcare system. Probably the one you're most familiar with is going to see your primary care provider. This is an example of an outpatient encounter. Outpatient encounters are ones where you are not admitted to the hospital. You just come to a provider's office to receive your care and typically only stay a short time. Outpatient encounters aren't limited to just seeing your primary care physician, however. Visits to specialists, physical therapists, and even small surgical procedures are all considered outpatient encounters. Each of these visit reasons can be used to label the encounter. We can further classify these encounters based on the timing of the visit. For example, the first visit with a provider may be called a new patient encounter, while other visits are called follow-up appointments or consults. For outpatient office visits, typically a single note is created to document what happened during the visit. There may also be some vital signs taken, laboratory tests ordered, and medications prescribed. For outpatient surgeries, there may be notes from the surgeon and anesthesiology team, as well as from the nurses responsible for pre- and post-operative care. There's typically a record of which medications were administered and other important details about the procedure. More complex surgeries or other interventions where extensive medical treatment is required are called inpatient encounters. This is where the patient is admitted to the hospital for intensive treatment that can last hours to days or more. Because these encounters span a period of time, inpatient encounters are defined by the start of the encounter, or the admission time, and the end of the encounter, the discharge time. When a patient is hospitalized, they encounter many healthcare team members, from physicians of many specialties to nurses, pharmacists, physical therapists, social workers, and more. Each of these care team members must document the care they provide in a variety of formats. Inpatient encounters typically have a number of notes generated, one at both admission and discharge, as well as daily summaries recording what happened in the previous 24-hour period and planning the next 24 hours of care. Patients are also often connected to machines that automatically record their vital signs, producing significant volumes of data. Overall, inpatient encounters are not only medically more complex than outpatient encounters, but they also produce far more data. One last physical encounter type is the emergency room. Sitting between outpatient and inpatient care, these visits can range from simple care, similar to that provided in outpatient encounters, to severe trauma where patients receive surgery and are ultimately admitted. Beyond physical encounters are phone and electronic encounters, which can be equally complex. But for the sake of this specialization, you really only need to know that encounters like phone visits or e-consults are classified similar to outpatient encounters. Messages, either by phone or secure email, are considered a different encounter type and can occur between patient and provider or simply between members of the care team. That was a lot of what. How about the other three W's? The who, why, and when. Actually, much of the encounter information is automatically generated as a function of how EHRs capture data. So by understanding the what, or the types of encounters, you already have a lot of what you need. However, it is important to know that the encounter types for physical encounters are typically assigned by scheduling staff, either before or after the visit.